How do you think where do you think I am?
I'm not sure. I think you're doing great though.
But,
yeah. Yeah.
That may not be as far as I think probably.
What do you think?
Well,
what do you
don't
think?
know.
You don't know. You could just check and see and just like put the worry out of your mind. You know, just know exactly where you're at, what's going on. If you want to.
I think I do. I'm not sure.
Okay.
I think I do.
Okay.
I'm Laurie Fremgen, and I'm a certified professional midwife.
And I'm Julia Bauer, and I'm a certified nurse midwife. And we are a Honeydue Homebirth.
Midwifery is really woman-led care, meaning that it's the woman who guides us into what she needs.
When we go to a home birth, we are guests in your home. Sometimes what gets skipped in traditional maternity care is that psychological piece. Our visits last an hour, and the physical aspect of that visit is pretty quick. We'll feel the position of the baby, measure how big the baby is, listen to the baby, take your blood pressure. And all that can take 5 minutes, 10 minutes. So the rest of the visit is really just getting to know each other, figuring out what is going to be the best way to support you in labor and postpartum, working through any fears you might have, whether it's things left over from a previous birth or things you've heard about labor and birth. So by the time you get to your baby's birthday, you feel as confident and as supported as you can, because that's how you're going to birth the best.
She's doing great. She's 9 centimeters, and baby's gonna be coming soon.
When she's in labor, I think we're pretty good at reading her, like what's going to be helpful. And some women need and want more hands-on. And some women just want a quiet presence, you know, either in the other room or on the other side of the room.
Well, when we come to a woman's house, we bring our birth chair and a birth tub. We also bring equipment necessary for things that come up in labor, like herbs or oxygen or IV equipment. So we're basically prepared for just about anything. As we're monitoring the baby, the woman doesn't have to change positions. We just listen quietly, say, wow, you're doing great, baby sounds good.
And we'll check blood pressure and that sort of thing to make sure the birth is progressing normally and safely. Sometimes we'll do counter pressure on her back, or sometimes we'll suggest a position change. Often, we just leave her alone because she knows what to do. You know, her body was born to do this. We find at home where a woman is able to get up, walk around. If she's hungry, she gets something to eat. If she wants to take a shower, she does. You know, she might get in the tub. She might go outside for a period of time during her labor. Maybe she'll walk in the backyard. Wherever she feels comfortable, that's how her labor is going to progress the quickest.
It's the woman's body, it's the woman's experience, and she's the one who knows what she needs and what's going to work and what's not going to work. And sure, there are times when women get into labor and they're like, I need help. Can you tell me what to do next? And, you know, and so we're there to gently guide and make suggestions. But ultimately, the women know how to get their babies out. Even if their minds are not quite sure about how to do it, their bodies are doing it. They're like getting into the positions that they need to best give birth to their baby.
Good job, April.
Well, the first moments after a baby is born, it's actually a really special time in the woman and the baby's life. It's called the golden hour. And in that moment, the oxytocin level is at its peak. It's at the highest peak it will ever be in a woman's life. So what's happening in that moment is the woman's heart is wide open and the baby just comes in. And so that's the most important thing that's happening in that moment. We can see by looking if a baby is doing all right. And we can see by looking if a mom is doing all right. So if there's intervention that's needed, of course we'll step in. But the primary thing that's happening in that moment is the deep connection between the mom and the baby. So there's nothing that really needs to be done. The cord doesn't need to be cut. The woman doesn't need to be cleaned up. You know, these things can all just wait. We love our job.
We've got the best job ever. Sometimes people ask me, why do you want to be a midwife? Why are you a midwife? And it's like, why don't you want to be a midwife? That's what I don't get. Doesn't everybody want to be a midwife?
I know.
It's so fantastic.
We get to work with women and families so intimately. And for me, it's the perfect mix of science and intuition. And to be around when a baby comes out is just such a gift. It's a huge gift.
To the sea of say